You can also use the friction reducing device to help facilitate your sling application. Imagine you have a patient who arrives in a wheelchair and you do your quick mobility screen. Mr. Jones, are you able to scoot forward and slide towards the edge of your seat?
No.
No, he can't sit forward. So instead of having someone go to the front to pull the patient forward, you can take your slide tube first and insert it behind the patient's back in front of the chair. So I'm going to hand this over to Mary. And again, you want it to be very taut. You're going to put it right in front of the chair, behind the patient's back, and you're just going to thread it through. So it's going to go all the way down to the top of the chair, the seat. Then you're going to grab your sling. And of course, you're going to ask the patient to do as much as they can. So if they can sit forward just a little bit, take the sling at the very bottom, really, really tight, and just in front of the slide tube behind the patient's back, slide it all the way down until it reaches the tailbone. And for those patients whose limbs are very heavy and it might be difficult to slide the sling underneath, again, use the friction reducing device. So take your slide tube, find the patient's thigh, go above the seat and under the thigh, tuck it under to create that slippery surface, and then you can take the sling behind the patient's knee, thread it through, find the top of the sling and push it under the leg. And it slides through much more effectively than not using anything.